and welcome to Asking Autistics. I'm your host, Lindsey, Brains and Spoons, and today I am joined by Dr. Jessica Myszak. Jessica, can you tell us a little bit about yourself?
Yes. So I am a Chicago area psychologist who specializes in neurodiversity-affirming evaluations. And I have a private practice here in the Chicago area where I see many local people, but also see people across the country through my PsyPac licensure. And so I love working with adults, do a lot of late diagnoses and second opinions for people who've had some pretty negative first experiences with evaluation. And I also do a lot of evaluations for children and adolescents who are possibly meeting the criteria for PDA. So those are kind of my two big areas of specialty. And I have a presence on TikTok also. So I do a lot of education and information about diagnosis and autism in general on TikTok for now.
Yeah. For the tiny amount of time, we don't know. TikTok, it's been so chaotic, like trying to figure out what's going to happen there. It's
Totally.
It's wild. So you said primarily you've been working with a lot of adults, especially folks getting like a late diagnosis. Would you say that you're getting a lot of referrals from almost like the internet, like people have seen content and then start to wonder about their own diagnoses?
Yes, absolutely. I would say maybe 50% of people find information on their own. So they are realizing that things seem to be a little different. Some things maybe seem to be a little bit harder, or just their experiences are different than other people. And so for many of these people, I think finding information on social media or coming across a blog or something else online really strikes a chord with people and maybe starts that journey of self-exploration. So that's been a really cool aspect of having a social online presence, because there's a lot of people who are really first learning about what autism is. I think for a lot of people, they think they know what autism is, and oftentimes that is based on some pretty significant stereotypes and portrayals of things in movies or things like that. And so once they start actually seeing autistic people or hearing about, what autism might actually look like in adults, that's sort of changes their perception and oftentimes is kind of a shock, like, oh, wait a minute, I do these things. How might this actually apply to me? So yeah, I think that's been a huge aspect of many of the people that I see. And for other people, there's many people I see who have always wondered in the back of their mind, or, maybe somebody has made a comment, or an autistic or friend with ADHD might say something like, oh, yeah, we're really similar, we're really alike. And so, I think people kind of come to this thought of getting an evaluation in different ways. And I love to be a part of that. And I think that by putting myself online and putting myself out there and talking about it, I think for a lot of people who are really scared about what that evaluation process might look like, or might have heard, some really negative things, I think people feel like they know me a little bit, or they know, what that might be like. And so it's a little bit less scary than it might be going into it totally blind.
Okay, so let's say somebody is coming in for an adult evaluation and seeking a diagnosis. What would that look like?
Yeah. So in my office, one of the things that we really like about the way that we work is you don't have to make any phone calls at all. We do a lot of stuff online. We do. Yeah.
Yeah,
I know that's huge for a lot of people. So we do a lot with email. If you reach out to us over email, you don't have to do a single phone call if you don't want to. And once we set up a time and set up a schedule, we tend to send a couple of questionnaires on the front end. And so we get some of that background and history information from people. We have people fill out some measures that look at social competence, or how people feel about their social skills, a personality measure that looks at some of the things that go along with neurodiversity, but also some of the other things that might play a part or might be important for us to be aware of in terms of the evaluation. And so we have people do all that on the front end. And so it's kind of a lot of work at the beginning. But then that helps because I'm able to know a lot about a person before I actually meet with them. And that is also helpful because, especially if somebody's coming into my office and I'm aware that, hey, smell sensitivity is a big issue, or light sensitivity is a big issue, well, I can be really careful about not eating my lunch in the office before they come in, or having the lights dimmed. And so it can be a more comfortable environment for them. And then in the appointment itself, we do a process called the MIGDIS-2. It's a diagnostic interview, and it is so much more appropriate for adults than some of the other measures that are out there. And really, it is a structured interview. And it's a really neat opportunity for us to have a conversation about the person's interests and what their school history was like and what their work history has been like and what their friendships and other relationships are like, and really kind of going through a lot of those characteristics from the diagnostic criteria, and getting to spend time delving into this stuff with people. And typically that takes between 2 and 3 hours, depending on the person. And then if we are looking at other things, so each evaluation is a little bit different. So sometimes some people are also worried about ADHD, or maybe they've already been diagnosed with ADHD, or maybe they're concerned about learning disabilities or other types of cognitive things. And so there's times where we add extra things in, but the standard really for us for looking at autism is that long interview and going through that. And so in our practice, one of the pieces of the diagnostic criteria is having a background or history, that there's some early signs of this. And so that's one of the pieces that we gotta investigate. And so I think one of the things that we do really well is we don't say there has to be a parent interview or it's not going to happen. And I do think sometimes there's places that do that. And so for us, we give some different avenues. And so if you have a parent who you feel confident about and who you trust and you have a good relationship with that is willing to talk to us, awesome. We would love to do a parent interview and hear about, what those toddler years were like or what some of those early years in school were like from a parent's perspective. But if people are not comfortable with that, sometimes people will have a conversation on their own and share notes with me about what their parents said, or sometimes they'll have a sibling or a friend or a spouse. And so really now we're trying to essentially make sure that this isn't something brand new, because there are some conditions, sometimes, for example, anxiety, somebody might be really, really great. And then suddenly this anxiety is really kicking up a lot of stuff for somebody. And so basically we're trying to do our due diligence, but also be respectful of the clients that we have and not trying to throw these things in the way that are going to make it harder, because it is so difficult for a lot of adults to get a good evaluation.
Absolutely. And I think you've made such good points. One, just about learning about people's sensory needs from the get-go so that you can almost start accommodating them at the beginning of the process, which is amazing. But I also think, there's plenty of people, especially like they've been throwing out all these statistics and things about millennials separating themselves from toxic family members. I know that ABC News and NBC News were putting together like a whole series about it. They have reached out to some friends of mine and things like that about folks our age, like setting boundaries and not spending as much time with their parents. And so, that could be an issue because it is really important in this process that you are going back to childhood, that you do have a lifetime history of these struggles and the way that in particular autism manifests in childhood. Like there's specific markers that we can look for. And so I think if you don't remember your childhood, this is going to be a much more difficult process if you, again, don't have a family member. But I know for a lot of us, for myself going through the process and then like my partner's family and things like that, there were like family stories, family jokes that looking now through the lens, the eyes of autism, it's like, oh, they would put themselves in timeout. They left their own birthday parties to go sit in timeout because the sounds, the lights, the kids, the foods were too much. The jokes are like, as a baby, they used to cover their ears all the time because they didn't want to hear other kids cry. And it's like, hello. And so it's interesting, not only if you bring a family member to have these interviews with you, or whether you just give them a questionnaire or you get some input on the phone, whatever it may be, going over this stuff with family members is this big aha moment sometimes. Like,
yeah. Yes. Well, and that's something that I really like too, is that when I do get the chance to have a family interview, sometimes the person is not exactly aware of what the evaluation is for. And in those cases, I'm being a little bit more vague. I'm certainly not trying to share anything about the person that the person's not comfortable with me sharing with that family member. But oftentimes when the person does know I'm getting this evaluation, I think that I might be autistic and I think that this is something that's important to me. And so the person's had a chance to really think about the background. They're prepared for this conversation. And what's neat about it is lots of times they have some questions for me, or sometimes they feel a lot of guilt that they missed something, that they maybe wondered about stuff, but were told by the pediatrician, oh, don't worry about it. And so in some ways, it's a really neat opportunity to sort of prepare this person to be a better advocate for the client in their life. And so to be better prepared that, yeah, there's a good chance that this person is autistic. And certainly not saying anything before I'm sharing information with the client, but it's neat then that they can have a chance to ask those questions they might not ask their own son or daughter, or ask about, hey, how could I learn more about this? Or is there any resources? And so I think that's a really cool thing that when people are kind of on the fence about it, I always say, I think that there's really some advantages to having your family member talk with me, because I'm only going to share positive information with them. And I think that's pretty cool.
It's great. I mean, you're able to sometimes build these bridges for family members. Have you had the experience that I know quite a few therapists have talked about this, that as they were diagnosing a child with autism, that the parents are going, but I did that too as a kid. That's totally normal. And they keep saying, but I do that too. I do that too. And then they kind of come to a realization during
I think that happens
the
all
process.
The time. Yes. So I very frequently will see one family member and then hear about either that they're getting another evaluation, or they'll reach out to me to do an evaluation of the other family member. And it goes both ways. I think it's much more common for children to be identified for assessment needs now than it was years ago. So I think lots of times it's a child evaluated, and then parents want to get their own evaluation. And sometimes that's for their own information. But a lot of times, and this is a really beautiful thing, I think, they're saying, hey, yeah, I want to show my child that, that I'm there with them and that we're a team. And it sort of helps them, again, advocate for their child, maybe the greater family, or helps them advocate for them in school. And I think that's awesome. But lots of times it can go the other way too, where maybe a parent will suspect that their child is autistic, but maybe they're not quite ready to get an evaluation, or maybe they're on a long waiting list somewhere for an evaluation. And in the meantime, they're thinking, yeah, all this stuff kind of tracks with my own childhood, and hey, maybe I'll get my own evaluation. And that sort of helps give me information going and to be better prepared for child's evaluation too. So it's kind of neat. It goes both ways.
Yeah, it's interesting because, I think for a lot of Gen Xers and folks like that, they grew up with this idea that don't label your kids, labels are bad and things like that, and didn't realize that having diagnostic labels, especially, from my experience, has been so helpful. Because something's wrong, okay? You always knew something was different or felt weird, or you struggled with things that other people didn't seem to. And the world labels that lazy, weird, bad. And so having the label of autism and ADHD actually freed me, made me feel like, okay, this is my brain wiring. This is not me being a bad kid or things like that. And so it's been really interesting to see throughout the community how this has started to change a little bit. We're seeing people become a little bit more comfortable talking about autism, or actually referring to themselves as being autistic. And it goes beyond, like you said, the original stereotype of a little boy. That now I have these grandmothers that I'm encountering who have told me, I got my diagnosis today. They're like, I'm 78, said I was going to do it before I died, and I did it. It's so exciting to see that.
Yeah, no, I agree. And I think that there's a huge advantage to understanding that if you're different, why, is there a reason? Why is that? Because you're right. I think those middle school peers, they sense differences,
Yeah.
And they come up with their own explanation for it. And I think that voice that many teens and even adults have in their head is usually a lot more negative than the actual diagnosis. And so, yeah, absolutely. It's nice to know, okay, this is not me not knowing how to do something. This is not me being lazy. This is just the way my brain works. And I think there's enormous comfort in that for a lot of people. And I love being able to share that information with people when that's the case.
And I think people have a hesitation about, well, one, I completely understand how expensive it can be in a lot of states and for a lot of people to seek a diagnosis. And then the other aspect is folks are like, well, I've gotten this far. I'm already an adult. What is the point of it? And for me, it was for my own mental health. I needed to know this to help me grapple with my life and things that I had gone through. Have you found that it's been helpful for people to have a diagnosis, even if they are 30 plus years old?
Yeah, I've evaluated people up in their 60s and 70s too. So yeah, I think there's a wide range. And I think the biggest reason why a lot of people reach out for evaluations is for that self-knowledge. It's because, and oftentimes they have self-diagnosed. I would say 75% of people that have reached out to me have already self-diagnosed. They've looked and spent tons of time, but I do think there's a shift between this for many people, not everybody. I think, again, I don't think evaluation is necessarily imperative for everybody. I think there's some people where if you feel confident, if you feel good, it's not causing any challenges to not have a formal diagnosis. That's fine. But I do think there's a lot of people who in this process they are gathering a ton of information. I mean, it essentially becomes their special interest to look at neurodiversity information. And I think that can be really overwhelming for people. And it can be kind of a hard place to be because I think you're, constantly consuming information and seeing what resonates. And there might be some things that don't because every autistic person is different. And so there's going to be some stuff that doesn't quite fit. And rather than letting that be like, well, maybe I'm not, or, maybe there's just a little doubt in the back of your mind. I think sometimes having it on paper, having an evaluation for some people helps them move past that and sort of just start living it and not worry so much about it. So I'd say, for a lot of people, that's the really big thing. I think for some of the other reasons I see people seeking diagnoses are to feel more confident talking about it with other people, whether they're sharing information with family members or healthcare providers or, just other people in their life that either don't see the validity of self-diagnosis or just don't understand it without having it confirmed by a doctor, which again, it stinks, but I think that is the reality that some people live in. And then I think the other thing that I see people getting evaluations for are sometimes for help with accommodations, whether it's school, whether it's work, if the office environment is too overstimulating, or if they need dorm room or meal plan isn't going to work for them, or they need other types of academic accommodations. It's really helpful to have documentation in a lot of those settings. And so it's nice to be able to provide that for people so they can get the support that they need to be successful.
Absolutely. I think for me, like if I had this diagnosis, ADHD and the autism diagnosis, for college, life would have been a whole different ball game because that's for not only me, but for a large percentage of folks who are high masking is when we are put into this situation where things are all up to us. We are supposed to be independent. Like, things aren't scheduled all out for us. We don't have parents and teachers setting the schedule and the boundaries and everything for us. Is that college is when a lot of, and even that age, your first job or things like that, trying to get an apartment, that is when you see a lot of burnout happen, a lot of debt, and just this idea of things falling apart, where like you held it together and then it just crashes.
Mm-hmm. Yeah, I see a lot of young adults, and I would say especially with young women who that first year of college is really, really tough. And I think, it's a huge transition. I think part of it is too, people have their routines, people have their safety of their home, where they can go home and they can completely unmask and they get to college and they have a roommate and they have no downtime. And so just masking nonstop, and suddenly college classes are a lot harder. Plus you have to make sure you're doing laundry and you have to keep up with all these other aspects of life that maybe your parents were taking care of before, or at least you had systems, that you didn't have to think about them too much. And I mean, I've seen too many women who have had to drop out, had to get pulled out, or had other, kind of serious things like eating disorders, just trying to grasp onto any sense of control that they have. And for so many of these people, they had no idea they were autistic at the time, and they just knew it was tough and didn't quite understand why.
Yeah. And so getting a diagnosis and being able to have accommodations can be a life-changing opportunity, I think, for folks. And like you said, especially like young women. Have you seen mostly women in your experience, or are you just getting a little bit of everybody? Because I know some friends of mine are seeing an influx now of women seeking diagnosis because we went undiagnosed for so long.
Yeah, I certainly see more women than men, but no, there's a lot of undiagnosed men too. Again, high masking, feeling something was different, but not quite understanding why. I would say probably 2/3 of the evaluations I do are of women.
I can't quote the statistics off the top of my head, but they've said that the largest group of diagnoses for ADHD and autism is amongst women. So I
believe it. Yeah,
women over 18 are the largest influx.
Yeah, and I think a lot of that has to do with the way that girls are socialized. They're socialized to just go with the flow and don't complain too much about stuff and
internalize
absolutely.
everything. And so, yeah. And I think for so long, like the stereotypes or the examples that were given in the DSM and things like that, again, were all very specifically targeting little white boys. And so if you deviate from that in any way, it's not noticed, right? And so if you have very stereotyped special interests, but they are considered girly, then you're not noticed, okay? Like, not every autistic person is obsessed with trains or lines up blocks or cars, okay? If little girls are over there lining up their Barbies in a row and color coordinating everything, or are hyper fixated on horses, well, that's just girls being girls. Like, there's nothing to see here. And it's like, okay, just switch this out for the other, and like, it's the same.
Absolutely.
Yeah. So I see that all the time. Just with people constantly talking to me, they're like, oh, well, my son is autistic, but my daughter, I mean, she doesn't care about trains. And we're like, well,
right.
Okay. Like, yes, I do know plenty of train autistics. I also find trains to be fascinating, but that's not the only thing.
Well, and I think too, one of the big things that I see for a lot of high masking folks, a lot of women, reading is really huge. So girls that would spend all their time reading and went through all of the Harry Potter books or all of the Boxcar Children books. Again, talking about some of those stories that people hear. Some of the things I've heard several times is, oh, I got in trouble. When I would get in trouble, I'd get my books taken away, which again is not something that you hear with many kids in the general population, but
part of my assessment was talking about, the putting a book inside of another book, having read the entire textbooks, front to back, cover to cover. And teachers would be like, you're not paying attention, like, because I'm reading a novel at that point. And so then they'd try to test me. They'd ask me a question from like, what would be the final exam? And I would know the answer. And then they'd send me to the principal's office for being, rude, uppity, having an attitude. And the whole time I'm like, I don't understand.
Right.
I did what I was supposed to be. Right. Like, I answered the question they asked me correctly. Why am I getting in trouble? So yeah, there was a lot of those times going through my assessment was like, oh, okay. Like, did teachers hate you because you asked questions? And I was like, yeah. I would always be like, okay, but why? Why do I have to do it this way?
Right.
And I was earning
knowing that, like, calling them out on something that maybe wasn't factually correct.
Mm-hmm. That happened. And it was like, how dare you? Because I grew up outside of Chicago in a low income area. And so I think a lot of the teachers came into this with this expectation that none of the kids were going to be smart, or none of, they had their own biases. My parents got called into so many parent-teacher meetings that ended up, they were like, but she wasn't behaving badly. She knew the answer. As a second grader, she wrote like 100-page report on these birds, but didn't want to keep coloring them in. She went above and beyond, but
it didn't quite meet the criteria of the assignment.
Right? They were like, no, we wanted her to color pages. They're like, she wrote 100-page report on birds, which also, like, special interest, guys. Most third graders aren't obsessed with corvids. Anyway, it's cool. So in the evaluation process, you're looking for certain criteria for the autism from the DSM-5 TR. And I think that's where a lot of people, I'm starting to see online, getting to these conversations of like, well, the DSM is flawed, so you could be autistic and not meet these criteria. And I'm always like,
It is flawed. Yeah, we know it's flawed, but also that's what we have right now. And so I think using the tools that we have, and again, who knows that, I think we probably will see changes in it in our lifetime, but that stuff does not happen very quickly. And I think one of the things that really has influenced me as a psychologist, Donna Henderson is a psychologist who has written a book. I think she's writing a second book that is helpful. And what it does, it sort of translates a lot of these criteria into how they look for women. And she has a book, I think it's called Is This Autism? And yeah, she's fantastic.
That's on my to be read list. So now I'm going to move it up. Like,
excellent. But yeah, she really walks through it. And again, a lot of the things you were talking about how these things that we expect, these ceiling fans planes or trains can only be, these examples of special interests. And no, like these things can be much more subtle, but they're still present. And so some of the diagnostic criteria, the things that I'm looking for are looking at differences with social communication and social interaction. It's really tricky because the DSM is written from a deficit point of view. And so I always try to explain this to clients, when I'm going through this with them as we go through results of an evaluation, that we're not taking the masking into account. And again, it's sort of comparing to a neurotypical population. And so I don't want people to feel like, oh man, I'm not doing this thing. No, it's just a difference. It's a difference. And it just looks different. Some of the big things that I'm assessing for and looking for are differences with that social emotional reciprocity. So having those back and forth conversations, feeling comfortable initiating with other people, starting conversations and responding to people, but also not taking the conversation over, leaving room for questions and not necessarily wanting to control the topic of conversation, because that can be challenging for a lot of people. And it's interesting, I do think, especially for high masking folks and late diagnosed folks, a lot of them have already come to this conclusion. They've realized, like, when I talk about these interests, I tend to go overboards, or I tend to go on and suddenly notice this person is, the glazed eye look. And so a lot of them are like, well, I just don't really talk about it. Or they have, certain people and they're like, yeah, we just, we take turns. I'll info dump about my topic, and then my boyfriend will info dump about what he wants to talk about. And that works out really well for me. And so you can have awareness of this. You can be very aware of it. But a lot of times people do have examples of, yep, this has been an issue, and I've kind of learned how to mitigate this in my life because I recognize that it doesn't land real well with the general population. And that brings me to an important point that a lot of this stuff is either currently or by history. And so people can have experienced it before, and they don't have to currently be displaying this at a really high level. It can be something that was there, and it still counts towards a criteria.
And in my diagnostic process, when I was going through this, we talked about directed play, that as a child, I was incredibly bossy, and to the point where, my siblings, my family members would all be like, oh yeah, Lindsey was she was a lot as a kid. Like, it was like I was directing a little theater troupe. And I said, you're going to say this, and then you're going to say this, and you're going to do this, and you're going to stand here, and you're going to be this character. Like, I would plan it all out, and heaven forbid another child didn't want to do this, then I was like, I'm not playing with you. Like, I would just leave. Sometimes I would like run, leave. There was some elopement going on, but because I was hyperverbal, it kind of made up for that, because I would have reasons behind why I did things. But the directed play then turned into me having to create coping skills as an adult, because otherwise I would have no friends. No one wanted to be around the person who's trying to control everything. But we see that, like, then as you get older, maybe you become a theater director. Maybe you use these skills in other ways. Or maybe if you're an info dumper kind of person, maybe you end up being a teacher. You end up being a professor. You end up spending your life in that topic, in that subject that you love.
Absolutely. And I think, going back to what we were talking about before, say you were telling everybody what to do. I mean, from the outside, it probably wasn't super obvious to a teacher or to somebody on the playground that, this play is kind of one-sided here. Like, she's always the one telling everybody what to do. It just looks like you're playing. And so that wouldn't have been something that would have necessarily set up a red flag for anybody to say, oh, we should get this kid evaluated.
Yeah, it was like, oh, wow, leadership skills, as opposed to this is the only way I play. Like, when we played store, it was so I could show off and organize the collections of things that I was hoarding. It was never to like do the actual like buying, shopping. It was not a role play activity in that sense. It was always got to be in charge and always want to set things up accordingly. I still think that's really fun. If you give me like an office supply closet, I will organize the mess out of that. But like, if I turn the camera around right now, like the rest of this room is chaos because of my executive dysfunction. But if you gave me a whole bunch of pens or something from your office, I would just be set for hours just putting those things in rows. But again, it can manifest in different ways. And so that's why it's really important to dig this out, like up from your childhood, and to figure out how this is manifesting if you have a lot of coping skills and you've been masking decently for a long time.
Absolutely. Some of the other aspects, things looking at social emotional reciprocity, looking at some of that nonverbal communication. And so both understanding and using nonverbal communication, so facial expressions and body language and those kind of things. And then what I always find super interesting is that for a lot of autistic people, they know the people in their lives. They're like, well, yeah, I mean, with my family members, of course I know when they're upset. Of course I know when they're bored. They can just walk in the room and I immediately know, or they're really good at like kind of reading the energy in the room. And I think a lot of that is pattern recognition and being able to really, really know the people that are important to them. But one of the questions I'll ask is always, what about people that you don't know so well? If somebody was flirting with you, would you recognize that? And then there's sort of the difference there is like recognizing some of this nonverbal communication that you haven't studied, that you haven't, had a chance to get to know really well. And so for a lot of people, there is that big difference there. Eye contact is a really big part of that too. And there's a lot of people who you would never notice any differences with eye contact, but maybe they had a mom who really got onto them about eye contact. Or, maybe they have some tricks that, I look at somebody's nose.
Yep. Yeah, you look at their nose, you look at right here, right here, right here, right here. Yeah, it's interesting is because I worked in special education and also ABA and stuff, which is a whole nother thing. But I worked with autistic students and clients for so long that I was always like, oh, there's a trick for that. Like, oh, here's this great trick you can use. Not realizing like, oh, Lindsey, these are just coping mechanisms that you have used to mask your autism and you're just handing them out to all these other autistic people because I just didn't know. The funniest thing is everybody be like, wow, you are so good with autistic students. Like you just like relate to them and they don't make you upset. Like you're just like, oh yeah, that's understandable why they would do that. I was like, because it bothers me too. I hate that too.
It's interesting. I do see a lot of teachers and counselors and people who work in the ABA field, who have kind of gravitated towards some of those areas because of some of those, those things that maybe they didn't even recognize in themselves. But yeah, being able to really understand, really relate. And so I always find that fascinating too, that some people are like, oh yeah, no, I got into psychology because I, was really kind of trying to understand myself and I learned a whole lot more than I thought I would.
Human behavior, became a special interest for so many people I know because we were trying to figure out like, okay, why are they doing these things? It feels like other people have a rule book that they got that I don't have. So it was almost like being like an alien sociologist or a paleontologist, like looking at it being like, okay, how do I perform being a human? And so that is something that continues to fascinate me, like human behavior and psychology. But yeah, I think theater is another thing. A lot of, especially like me and people, my friends on the internet, a lot of the autistic creators, people making video content and things that you see online, almost all of us, I don't know any, actually, I can't name any who don't have some sort of theater background. They were in theater performances at school or they took classes and things like that. And that helped us learn how to do these kinds of social skills and the nonverbal communication things were taught because I don't naturally do. I don't want to be like, I'm not naturally a human. I just don't do what other humans do. But I learned to do that as characters in theater. And so that's where I found, at least talking to other folks who grew up that way, we learned to mask seemingly expertly because we learned all these tools and tricks on how to perform being a human.
Yeah. Yeah. No, I've seen a lot of that too.
Yeah. If you're a super weird kid, like that's the place where you're accepted, right? Like, okay, all the weirdos come over here and, in the arts. And so, yeah, things like psychology and stuff, it is interesting to see how many neurodivergent people end up in these career paths because...
Well, and even find each other as kids. It's astonishing to me that time and time again, I've heard of people, oh yeah, no, I had this one best friend in school and we grew apart and came back together 20 years later and both of us have a diagnosis of autism. So it's just funny that, again, there seems to be so much of a challenge to get this diagnosis for a lot of people, but kids intuitively kind of have this sense for, who's similar and who's different and tend to, in some ways find people that they connect with, which is awesome. And in a more negative sense, there's definitely bullying in a lot of people's history just because kids sense those differences and can prey upon those in a lot of cases.
Yeah, there's a lot of talk, obviously, about trauma coming from your family, but I know I am in the other category of the public school system traumatized me more than anything. And I think that, and I hear statistics all the time, so I've heard all different kinds, but overwhelmingly, neurodivergent kids, especially autistic and ADHD kids, hear so much more criticism than their peers. And so, yeah, you end up with, those layers of then trauma and things like that. So unpacking that and figuring out something with a professional can be really helpful.
Absolutely. And it's, I think it's interesting because I think there is this sea change coming where, it's not only people trying to understand themselves. I think one of the cool things about the TikTok audience is there is a lot of adults who are still trying to understand, for their own kids, okay, how can I better support my neurodivergent child? So probably it is not going to be forcing them into sports and all these other activities and keep them as busy as possible and trying to recognize that when they come home and they need to crash at the end of the day, that's what they need. And that's what we need to give them. And so I'm just excited to see what happens because I think people are becoming more open-minded and more accepting in a different way than what parenting looked like when I was a kid.
Yeah, I definitely have started to see the shift in gentle parenting, but now also a lot more like neurodiversity-affirming practices where, like you said, folks are realizing that, okay, we don't need kids to be scheduled all the time, go, 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 that this is overwhelming for them. And even doing small accommodations and self-accommodations and things has made a huge difference. What's crazy is that when I was a teacher, getting fidget toys, like we'd have to order them from a specialty catalog, okay? Like they were only available from like the special ed disability devices catalog. And then I don't want to say ADHD went mainstream, but it did, right? And fidget toys, I'm holding one in this video right now, actually, guys, are wildly available, readily available. All of these things that like you used to have to buy from specialty places if you were an occupational therapist, if you were a special education teacher, if you were any of these things, are now like given out as prizes at candy machines all over the place. And so it reminds me of the concept that diagnosis is not pie. It's not like, oh, you took a piece and so now there's less for the rest of us. What happens is the more people that are diagnosed, the more people that talk about these things, the more parents that get involved and want to make, the world a better place for those of us who are neurodivergent, then the more things become accessible, the more things become normalized and available. It's not pie. It's not a limited finite resource.
And I think, and I think too, it doesn't hurt anything. I think that there's like, okay, so this kid is holding this thing in their hand. It's not something that's distracting. It's, it's actually helping. And so I do think, even for people who aren't neurodivergent, having a fidget isn't going to hurt anything. And so I do think that that's a really great thing that you're right. It's normalizing everything and it's just making it more accessible in a way that, it's very, very different from the way things were 20, 30, 40 years ago.
Yeah. And I'm hoping that we continue to go in that direction. I know there's going to be speed bumps. Any advocacy movement is going to have pushback and hurdles, but it's been really encouraging to see the more people who are open too about their diagnosis. I think that's been great. I know from my own experience of being very open online in places that I am autistic has helped other people come to terms with that and be okay. Or they told me like their kids, they show videos and things of me to their children because they're like, hey, look, see, other people are doing this and you're not alone. And I think just knowing that we are not alone is so freeing. It's okay. I'm not the only one. There's other people like me out in the world.
And it doesn't have to be a secret and there's no concern there. It doesn't have to be something you got to keep quiet about or don't tell anybody. It's something to celebrate and it's something to share because it helps you be successful. It helps you do the things that you want to do rather than trying to, force yourself into this box where you don't quite fit and it doesn't quite feel right.
Yeah. I mean, I even had to have this conversation yesterday where I have an assistant who handles my emails because I struggle with that part of executive function so much. That's why I had to hire her, because I struggle with it so badly. And I was feeling guilty because there's this company that wanted to work with me specifically because I'm autistic. And I have been ghosting them because I started to get all this anxiety about writing an email to them. And I just broke down and had to be like, I can't do this. I know it's not logical. I went through the whole thing again. And she was like, Lindsey, this is why you have me. They know you're autistic. We can just tell them, hey, that I'm going to handle the emails and things for Lindsey because this type of communication is not accessible for her and her communication needs. And it was like, I know this and I've known this for over a year, but you still end up going back and having a lot of shame and internalized anxiety about things. And so we go through the process continually. And so I don't want to tell everybody oh, you have to go get a diagnosis, because you don't. And self-diagnosis is valid. And there are so many reasons why you might not be able to get an official diagnosis or seek one out. But I will say, for me, my imposter syndrome gets really bad. I will sit here and be like, I'm not really autistic. I just suck at so many things. That's what my brain will tell me. And having somebody official actually go through the process and be like, yeah, Lindsey, you are autistic and you do have ADHD. That can be a lifeline for me sometimes. So I will always affirm people who are self-diagnosed, but I don't want to be like, everybody go see Dr. Myszak, but I just know what a difference it makes.
Yeah. Yeah. And I'm so happy to hear that. I'm glad it was a good experience for you. And I do think for a lot of people, it's life changing and it's really affirming. And, I see that as one of my biggest goals in an evaluation is being able to explain, yep, this is autism, or this is what it is. And of course, not everybody that comes to see me is autistic. I would say, again, that people who have gone to the effort to research and schedule, the vast majority of them are correct. The vast majority of people who think they are autistic, they know themselves, they are. But there are sometimes people who come in who are not quite sure, and there is a different explanation. What's interesting, sometimes I will see spouses who are convinced that their spouse is autistic, and I would say that is much less of a group of people who actually are autistic. Sometimes it's looking for an explanation why things aren't exactly lining up the way they want them to. I see myself as part of this process, to help people understand themselves. And I like being able to do that.
I think it's also really important when you're going through this process that you find a neurodivergent therapist, you find a psychologist, you find somebody who also comes from part of the community, because I have noticed that you can find folks who will do an assessment for you, but their own personal biases and beliefs and things may make it a not great experience. And so if you have the option, I would say to find a professional that is definitely neurodiversity affirming, but also if you can find somebody that has experience or are neurodivergent themselves, I feel like that has been the best scenario.
Yeah. And I know that there's some directories and things of people who are neurodivergent themselves, which is fantastic. So I myself am not neurodivergent, but I think that there is a huge difference. And I think it's almost a growing disparity between professionals who have listened to adult voices of autism and ADHD, who have gone out of their way to better understand and learn about what this looks like in adults, and those who are sticking with what they learned in grad school, which goes back to some of these books that were written years and years ago and really goes back to a lot of these stereotypes that is very, very different from the way adults look, and those who have gone out of their way. And so one of the things that I have stated again and again and again on TikTok and my own social media is it matters who you go see for an evaluation, because there are people who go down and so many of the things we've been talking about, so many of those little distinctions in the criteria, they're not even looking at that. They're not even seeing that. And they're, looking for some of those really black and white examples. And if they're not there, they're not even going to consider it. And I'll see this in groups of psychologists where some people are saying, oh yeah, no, I see a lot of adults who are coming to me from TikTok and almost none of them have autism. And I'm thinking to myself I bet you're probably not seeing things the way that I'm seeing them, because I'm seeing a lot of those same adults and I'm diagnosing much more than that. And so I think finding somebody who actually talks about autism, finding somebody who asking about how often they actually diagnose adults. I think those are really, really important questions to ask, because I've seen all kinds of negative evaluations or reports listening, that people have shared with me from some of their previous evaluations that, I just cringe reading them, because it's reading through all these examples of autism and then like, well, no, they're 1 point below. So nope, not going to diagnose or, just something crazy like that. And it breaks my heart, because people spend a lot of time, a lot of money, and, a significant amount of stress going through this process. And to have all that, and then, some little technicality or just the ignorance of the evaluator, makes the difference there.
Yeah. I mean, it's obviously an unofficial poll that I've taken, but I have asked the community before, what are the reasons that a professional told you couldn't be autistic, and got hundreds to thousands of replies, and it's all bonkers things. It's all so backwards, and these old stereotypes. It was that, yeah, they made eye contact, so therefore they cannot be. I mean, the fact that somebody is married, that they've had a job before. One of them was, she came in with her hair had been brushed.
Wow.
So it was like, I'm just going to stop you right there. You're definitely not autistic. Like, you brushed your hair before this appointment. So like, what? That kind of stuff. And yeah. And to know that people spent thousands of dollars, were on waiting lists to be turned away immediately because they brushed their hair that day. And it's like, it makes me so angry. It makes me live it. I mean, the idea, I've had folks tell me the fact that they had tattoos meant that a professional wouldn't evaluate them. I mean, just things that are so wild, where I'm like, actually, if you know about sensory seeking behavior, you would realize that a lot of autistic people have very different pain receptors than the average population. And some of us seek out that stimulation. And so things like tattoos are actually common in this chunk of the community. So it is bizarre to realize that there's a lot of people who are, professionals and considered well-educated in a field that don't know anything.
Yeah.
The basics of autism. But it's also something that's hard to admit. Right. I think for folks, at many different times in my career, in my life journey, had certifications that said I was an autism specialist. And I have actually had to unlearn just about everything that I was taught about autism. And that was me going to special trainings and things like that. And your average clinician gets maybe 2 pages in a textbook. It's just thrown in there with a whole number of things. So they don't know about autism.
Right. Well, and as a psychologist, you have to do continuing education, but with the exception of a couple of things that you have to meet, usually ethics and state laws and things like that, clinicians get to decide what they're doing continuing education about. So, there's going to be some clinicians who have never done any kind of updated information about neurodiversity. And, and again, unless they're spending their personal time and, are interested in learning about these things, yeah, they're going to have this antiquated knowledge that came from professors who learned about things. And the criteria has changed. But I think our current understanding of what autism is has changed even more than what is reflected in textbooks and in the DSM.
Absolutely. And like you said, this is an evolving process. Like, psychology and most sciences are things where the more research we do, the more things we learn, the more things change over time. But there's still core pieces that are in the DSM that are the basis for autism. So it's like you can take these things with a grain of salt, because yes, there are biases and things like that. But at the same time, there are criteria for specific reasons. And so there's, as part of the diagnostic process, they say, unless something else, accounts for these things. And so there's, sometimes that might be the case, is that you have something else going on. But a lot of the time, you're right, particularly with autism in adults, we tend to really research and really look into things. This is not something we do lightly off of a couple TikToks. I don't know anybody that would spend $1,000.
Right. and all
at
that
a year of their
stress,
time.
unless they're pretty sure.
Mhm.
Yeah, unless it really, really
Mhm.
resonates and yeah, they think there's something there. People don't volunteer for that, for no reason.
Right. Because it's not like it really gets you anything wonderful. There's not like, you get to go to Disney World because you're autistic, okay? It really is just like, okay, well, people in your life are still going to say negative things about you and criticize you, but now you understand the inner workings of your brain and body a little bit better.
Right. And that's, I think you bring up a really good point that there's, I think one of the big criticisms that I think people that don't really understand make is that, oh, all these people are getting diagnosed with autism and it's taking resources away from, those people who really need it. And like, well, I mean, what kind of resources do you think that they're getting? Really, it's mostly for their self-understanding. It's not hurting anybody else for an adult to recognize that they're autistic.
Yeah. And in fact, as somebody who has been in the autism community for so long, working in different capacities, it's been helpful for there to be more people with diagnoses because we have access to platforms and we can communicate to a larger amount of people than, say, somebody's autistic child can. And so having more advocates for the community and more people saying like, hey, like, things like stop the shock, like stop electric shocks to autistic people should not be legal and should not still be practiced in this country. And it is. Okay. There's a lot of things that like a lot of really terrible practices that are still going on in the disability community that, again, those of us who get a late diagnosis are helping with. Like we are jumping in to these situations, trying to advocate and things like that. And so, yeah,
Well, and I
again,
think, yeah, writing books and doing research. I think, yeah, there's a lot of really highly educated autistic people who are changing the field of research and changing the public perception. And I think that's fantastic. And like I said, I do some evaluation for children too. And that's one of the big things I'll share with parents is listen to those autistic voices. Yeah, your child might not be able to tell you this right now, but you can fast forward and hear, what an adult is going to say about what their childhood was like or what they wish would have happened when they were a kid. And, that's a pretty awesome opportunity to be able to hear that and help that influence, which types of treatment you're choosing to do and how you're choosing to react to some of these behaviors and things like that.
yeah, because I think at the end of the day, autistic adult advocates, we want your child to have as many opportunities as they can. Like we care about you and your child more than you probably imagine. We are on the same side here. It may be hard to see that, I think, in the beginning when parents are drowning in information and very confused about where to go, but that autistic adults and autistic adult advocates want what's best for your child. We want the world and programs and things to be available for them just as much as you do or you will one day want them to be. So I'm like, let's be a team, guys.
Right. Right.
So yeah, I think what you're doing is so amazing. I'm so glad that there are professionals out there who are neurodiversity informed and proactive about this. I wish there were more.
Yeah.
Unfortunately,
Absolutely.
it's still a very small contingent of y'all. So you are licensed in Chicago, but you can do evaluations through another program you mentioned?
So shortly after COVID, there was this new legislation. It's called PsyPACT. So it's PSYPACT. And it's a program that's like a state reciprocity program. And so what's really cool about that is that because I'm licensed in Illinois and I have this reciprocity, if you're in one of these PsyPACT states, which I think is 42 out of the 50 states. So it's the majority of states. As long as you were in one of those states, I could see you over telehealth. And so that's been a really, really cool thing in the last couple of years. And, autism evaluations, especially for adults, are really easy to do over telehealth. I think that there's really no downside to doing it over telehealth as opposed to in person for most people. And so that's how I'm able to see people, from Texas to Florida to, all over the place. So that's been a really neat.
That's awesome. All right. Well, If people want to find you and learn more, where can they do that?
So again, with TikTok probably changing in the next couple of days here, I do know that I have a small footprint on Instagram. And if I'm finding some other platform, I'll have information about that there for sure. My name on there is Dr. Jessica Myszak. And then I also have a practice website that's just Help and Healing Center.
helpandhealingcenter.com. Okay, cool. Well, I am so glad that you said yes, you'd come on the podcast. This has been really good. And I'd love to chat with you about this again, about more, more things about assessments and psychology, because one of my little special interests that I also enjoy. Per usual, you can find me at Brains and Spoons everywhere and the podcast Asking Autistics everywhere. And we will see you next time. Bye.
Thanks so much.
Push all the buttons.